Good evening to you and welcome to iMed, and today too we will be continuing on the topic of leprosy. We discussed a lot about leprosy last week on iMed. We touched on what leprosy is all about and about the symptoms and the treatments available for leprosy and how important it is for you to get yourself checked as well. So we had with us Dr. Kapila Piyasena last week, and today as well we do have Dr. Kapila Piyasena, consultant community physician, who will be touching more on leprosy. A very good evening to you, doctor, and welcome to our program once again.
Thank you.
And we touched on very important topics last week as well.
Yes.
When it comes to leprosy. We discussed about the signs, symptoms, and about how one can, contract the disease as well. So today let's talk about the damages leprosy can cause. But before that, I think, doctor, you wanted to show the symptoms once again, didn't you?
Yes, I just people have not been listening to the presentation last week, so we can have this just a small description of what the leprosy is. I just give a picture.
This is kind of like a recap of what we showed last week on screen. So
and
this is the symptom.
If you have a symptom, if you have skin lesions like this, like mainly you commonly think of fungal infections, but don't think all the lesions that you see in the skin.
Can we have it on full screen, doctor, so that everybody can have a good look at it?
Yes.
So it is kind of a recap. We showed this last week, so if you missed out on the program, this is a symptom. If you have a lesion of this sort, it's something you need to be concerned about.
And then best thing is to go and show your OPD doctor, and then always you think of, could it be leprosy? That's what we have. My main aim is to aware the people that still the people think that leprosy is no more in Sri Lanka. That's a myth. The leprosy is there in Sri Lanka, about 2,000 cases in every year. Because of the COVID situation, we are seeing less patients, but that does not mean that we are having less patients, because the patients are there. The delay in diagnosis makes you the one that the problems of the question that you asked is what that I am going to talk about, is the one that happening because delay in diagnosis. If you are not come to the doctor with this sort of lesions, what happened is, I showed you last time some pictures like the losing your digits and having ulcers and losing your digits with the leg part. This sort of thing can happen if you are not taken your treatment early enough. But what happened now, you might say, now this is the old pictures that you don't see at the moment. But if you consider the statistics in Sri Lanka in 2019, actually that's the year that we can consider as a non-COVID year, because the COVID 2020 started and it dragged on till up to now. 2019, we had about 92 patients who have been grade 2 deformity. That means who have been affected the nervous systems, who have been unable to hold the pens, who have been having ulcers, who have been foot drops. That sort of things have been diagnosed. 92 patients among the 1,900 cases, and mind you, out of which 181 were children less than 14. Now, having 10% of the population, your disease population, the children, is a very bad thing. And other thing is, out of the 92, one child, about 2 children were having permanent disability in their fingers. They are unable to hold their pen the rest of their lives. Even though whatever we do, whatever the
damage is done.
Damage is done. Once the leprosy damages your skin, the nervous system, that means you can't recover. So it will be permanent damage. What we can do is minimize that with doing some surgical procedures, doing exercises, certain other things. But main thing is early diagnosis is the main thing.
And who are more prone to leprosy, doctor?
Yes, that's a good question. People who have been affected with leprosy is mainly the poor socioeconomic conditions. It's not only the poor social condition, but people who have been contacts with the leprosy patients. Now, there are certain countries who have been eliminated leprosy. Those are Scandinavian countries, because they are high socioeconomic conditions, and we have not seen leprosy patients for the past many years. And many countries who have been having leprosy at the moment are the developing countries. Our neighbor in India, they have about more than 200,000 cases. And Indonesia and Indonesia is the second highest in the world. So likewise, there are so many countries who are developing countries who are having this thing, because this spreads through coughing and sneezing. when we are poor socio-economic condition, the small environment, small room, maybe so many people are living in your household. What happens is when you have poor ventilation and poor lighting, when you sneeze, the droplets remain in your room setup, and then other people inhale it. The people who have been continuously inhale it, what the leprosy need is continuous exposure, continuous long-term exposure. Someone will affect in this one. Once it affected, you get the symptoms later in their life, not in early part.
As you mentioned previously, that there's an incubation
period about 5 years, but it will depend on 1 year to 20 years. So it can depend on anywhere, but the median is on 5 years. But mind you, there are 181 children are there, out of which I think many of them are, I think 50% of them are 10 to 14 years. The other one are from 6 years to 10 years. So at this age group, they are mainly at home or in the school setup. They are not going to the community. So therefore, the disease is spreading in the community itself, in the household itself. So when you want to identify patients with children with leprosy, you definitely sure that that source of the infection is there at home or in the home premises, or sometimes the extended family, sometimes maybe the grandmother, grandfather. I'll tell you a story because it will more attract to the people will listen to this. The recently, but 1 month back, we found a family whose one child was having leprosy, and then they came to the doctor and they found that later identified leprosy. And once we identify leprosy patients, we have a system. We are going to check the home and check the contacts who have been positive or not.
Just like how you check for COVID, isn't it?
That's right, yes. But this has been there, not we are doing it immediately, but we take a leisurely. Our PHIs are there. The system that, there's a system when you diagnose a patient, there are copies are being prepared, and these copies have been sent to different places, and one copy sent to the MOH. MOH will send to that different area, MOH area. The PHI comes and visit and check whether how many people are there. There are about 3 persons in that home. 2 grandmother and grandfather, another child was there. All 3 are COVID positive, they are leprosy positives. The grandfather, who was severely affected with this disease, and mind you, it's in Gampa district, I'm telling you, he had to do a surgery in your legs, and doctors were planning to do a lumbar puncture, and he was saying to the doctor, I don't feel anything any feeling in my, no sensation in my legs, don't give anesthesia. Likewise, but still doctors didn't, they didn't understand that, they didn't think that when people are telling so many things. But he told that PHI, I told the doctor, even don't give anesthesia, I don't feel anything.
It's already dead.
It already dead, since the nerve system has gone. And the mother, the grandmother, who was having fully blown faces, that means once you fully blown faces, that you get a lining faces, like your eyebrows are lost and your the base become very awkward feeling, and you lost your cartilage loss, and ear began nodulation. There are so many things are there, but I have not shown a picture like that. But then full blown lining faces of the grandmother. The grandfather is affected, the child also been affected. So that has been there, leprosy is there for a long time. They have not been diagnosed early. But the same thing happened, because our doctors are everybody thinking that leprosy is no longer in Sri Lanka. This happened in 1995. WHO identified Sri Lanka as a leprosy eliminated country.
Right.
Because the reason is, when they said our number of patients were less than 1 per 100,000 population, 1 per 10,000 population, less than 1 per 10,000 population, that means you are eliminated leprosy. So we were less than that level, so we were considered as a eliminated. Eliminated and eradicated is 2 different terms. Eliminated means according to that terminology, if you are less than 1 per 10,000 population, that's a 10 per 100,000 population, that means you are okay. In Sri Lanka, we were around, at the moment we are around 7.6, had come to about 5.6 because of COVID. So we are considered eliminated, but eliminated means does not that we are fully control of leprosy. Still the leprosy is prevailing now. Now, even though our total country rate is 7.6, certain districts we have more than 20 even. Now say for example, Western province has the largest number of patients in Sri Lanka, say about 40% of the leprosy patients are in Western province, Colombo, Gampaha, Kalutara. Even Colombo has the highest rate, and then the next the Gampaha, because these places the density is high, people live close together. Even the Gampaha district, so much garment factories and this thing, people live very close to each other. And what happened, when you close to each other, one person get it, can spread to other people very easily. This what happened in the Gampaha district, that place as well. And then even though the number of people are also high, the rate is somewhat close to 10 or 10 to 11. But when you go to Batticaloa, the highest rate in Sri Lanka in Batticaloa district is 21. So now consider less than 10 is the ideal mark, but in Batticaloa district, in the same country toward the east, highest number of they are in Batticaloa district. So there is a district variation also there. In the central province, where the Norelia, there are people are living in shanties and very smaller, poor, environmentally poor conditions. But still the lowest number is there in the Norelia district.
So does weather play a role as well?
Probably we have examined so many factors, even the weather, the humidity, so many things, but we have not been able to identify conclusive evidence. This is the cause in this thing. So many bacteriologists have given certain their hypotheses. It could be this, could be this, but we are not sure what I am telling you the facts. Facts is larger number of people are there. So now we are targeting mainly all our programs, educating people, educating the public, educating the doctors, and even educating the medical officers as well as the medical students and everybody. Leprosy is still with us, still a big part, because if I show you some pictures in this thing, the graph from 2001 until up to 2020, that what I have told you, it should be less than 10.
Yes.
That's 10. That's called NCDR, new case detection rate per 100,000 population. So in 2001 it's around 12.1. So this higher. Now later it became lower and lower. It fluctuated, and now it's around 5.53. But even still here, the Batticaloa district and the Colombo districts are all above the national average, because the average comes in the whole Sri Lanka. So therefore we see
these are all detected cases,
all
but there
detected.
might be
so many cases undetected, because people are unaware that this disease is there. Even the doctors, even the OPD doctors, especially the OPD doctors, are aware. Not that it's not their fault. Actually, I am always considering it's our fault, that we should be able to give more awareness among the information about the leprosy and the prevalence of leprosy and the area wise, but still we are not able to do, because it's a costly thing. Especially when you want to have this sort of program, it's very helpful for us to give the information to the people. But having a social marketing campaign is a very costly thing, which as a campaign we are not in a position to do it. But we asked from so many donors, and he was at this point, and nobody is helping us. So this sort of thing is very helpful to us. Give this message to the people.
Exactly.
Leprosy is still prevailing in Sri Lanka, and if you are delay in diagnosis, we are seeing more great deformities. Now our deformity rate is 5 times higher than the WHO expectations. Normally WHO says only 1 per million population. We can have less than 1 per million population could be having deformities, like deformity I am saying, losing your paralysis of your fingers, or having ulcers or foot drop like thing. But we are seeing 5 times higher. We have 92 cases compared to it should have been less than 20. So that's very high number of cases. So this is the problem that we are facing now. Delay in diagnosing causing more problematic cases, the permanent damage to the nervous system, and then what happened, there's no recovery, and we had to give more emphasis on rehabilitation part. We do now rehabilitation, certain condition we give the bandages and so many exercise equipments, foods, and special shoes are there. We have spent so much of our government Sri Lanka is spending that money. And certain donor organizations also giving this thing. So we are doing our best, but doing everything is no point, and giving a food is not a issue, but only thing is making a person diagnosing early without having a
it could save the life,
plus he can have a comfortable healthy life, comfortable life.
And doctor, some people are under the impression that it's a genetic condition as well, but listening to what you have explained right now, it's very clear that it isn't, but it's contagious, isn't it?
Definitely, yes. Because people think genetic because the mother is affected, the child is affected. The main reason is, it's a contagious disease in the family itself. Now, one person is affected in the family, is invariably the other will be contacted the disease. So therefore, sometimes when you diagnose a person with leprosy, the other when we check the other family members, they all may be normal, but as I told you earlier, there's a long incubation period. Maybe after 3 years or 4 years time, they'll become positive.
What if they're in the incubation period and they still want to have a checkup? Is that possible?
There's no test.
There's no
test available to check whether they are incubation or not. You are in the incubation period or not. There's no we are doing a biopsy
until a sign pops up.
At that time, that's why we are already mentioning, when you have a lesion like this, make sure that you go and show it to a doctor.
Which and means that you're over the incubation period.
That's right. Yes, you are spreading as well at that time, because there are two types of leprosy. That is a multibacillary type and the paucibacillary type. That is too many bacilli in your body and less bacilli in your body. I am just very simplifying the classification. Multibacillary type means when you are spreading more. That type of bacilli we have been able to identify about 60% of the patients. So 40% are paucibacillary. So therefore, we are seeing more patients with multibacillary.
And doctor, what if a pregnant mother is infected with the disease?
Now, pregnant mothers can get infected, and that time your immunity is less compared to the normal person. So therefore, chances of you are getting the disease and having the nervous problem and nervous tissue involvement and the damages are more higher compared to the normal person. So therefore, the pregnancy state mean that your immunity is somewhat lower compared to the other person, normal non-pregnant woman. So therefore, in pregnant women also recommend give the treatment, but not as a when you give the treatment and ask them to come 1 month, but you need a close supervision with your gynecologist as well as dermatologist and hematologist. There are groups of people involved in that sense to treat the person.
So the medicine won't be an effect on the mother, is it?
Normally, there are some publication literature over there, and they have given treatment. There's nothing happens affected to the child.
And doctor, is there a system to map out how many infected people are there in the country, and do you keep a track of it as well?
Yes, we do actually. We have a system called digital online data flow in Sri Lanka. Actually, we put this system, then we can collect data from all the district level. We have a public health inspector in each district for the leprosy. So what they do is when the dermatologist diagnosed a patient, and the clinic itself, they inform the PHI. The PHI goes and collect the data and send us the report as well as input into our digital data system. With the digital system, what we do is they have the GPS mapping as well. Then that mapping we can put them into our mapping, and we can identify the number of these are 2019 data.
Right.
Each dot indicate one patient. So therefore, now we can see the distribution of the patients in Sri Lanka. Now, what happened is when the PHI identified, he used to one PHI will goes to the house and identify the other contacts, as well as our leprosy PHI also go and give the treatment. So we are not like other system where the patient has to come and get the treatment. If you are unable to come, we are just not lagging behind. What we say is, if you are not coming within second month, we know that he is not coming to get the treatment. First month sometime they might visit, but second month he is not coming. That means you identify he might be a defaulter. What we do is immediately check with his contacts at home. We know his address and everything. Ask them why you are not taking medicine. Sometimes they are shifting one place to another. We are making sure to give the medicine. Even just for example, last week, few weeks back, 2 weeks, last week I think, the strike causes there's no medicine is available for the patients. But still our PHI, some PHIs are very committed to this person. So they said they are willing to give the medicine to the the clinic itself. Without going to the pharmacy, we just make sure that we collected the medicine from our campaign and we gave to the nursing officer in charge in that hospital itself. So they can give the medicine from then and there without going to the pharmacy. So therefore, we make sure that each patient will get their medicine in regularly without any interruption. So once he complete the medicine, he will be completely cured. There is no sequelae, and he will be completely cured, and he will be not spreading the other people as well. So therefore, it will be a this process. What we are having this process, giving the treatment, rehabilitation part.
This is also kind of like a method to eradicate leprosy.
If actually our main aim is to eradicate leprosy, getting contact disease is less. The mind you that 90% of the people who are not being even been exposed, you are not getting the disease. Only 10% the weaker one.
If you have a good immunity, you are safe.
Safe, that's right. And the one thing is, and in any person who have been thinking of having a disorder diseases, and you are at home, even your neighbors, even make sure that they will be getting treatment. And plus the contacts who have been there, make sure that you are every year to have one checkup in their body whether they are getting the leprosy symptoms, the skin lesions. At least one lesion is enough to make the diagnosis.
Doctor, we've come towards the latter part of the program as well. Any programs planned to spread awareness on the disease and about the methods and the medicine being provided? This is one way of spreading awareness, but
yes.
Any other programs organized by the Ministry of Health?
Yes, we are doing so many programs, like we are targeting different healthcare groups. Like when the medical officers are there, we are having separate set of programs for educating medical officers, especially in the OPD sector, and the GPs, the main target group. We are having separate programs for them who are in the private sector as well as in the government sector. And even we are having the public health inspectors as well as the midwives. So they are the one who visiting houses and awareness them. And we educating the general public, and we have different occasions. General public education we are having different way, like we are having school dramas and poster presentations, and even road dramas, like street dramas, like thing, that sort of thing. Also we are conducting and educating people the how to identify this thing and to reduce the stigma attached to the leprosy. That's the main part.
What about at school level in the Western Province as well?
School level, normally what we do is in school level, that's what's called school medical inspection. At the school level, we always instruct that our PHS as well as midwives, these are the symptoms and signs of leprosy patients. Don't miss this sort of symptoms are there. So we have given a checklist and ask them to check whether they, without removing the shirt, you ask them, do you have any rashes or anything, just clicking no, just to remove everything and just show them whether they have a rash or not. Just then only you can exclude that they have not leprosy.
Exactly, and this is also a message to everyone who's tuned in. So if you find a lesion and you feel like you need to get yourself checked, if it's not healing at all, you should be doing it right away, because it could be leprosy, you never know. So thank you very much, Dr. Kapila Piyasena, for being a part of the show and for educating us on this important topic. Thank you.
Thank you for inviting me.
And with that, we wind up this week's edition of iMed. Thank you very much for tuning in. Have a pleasant night.